Dr. Rajesh Vukkala, consultant physician at Medical Hospitals, Hyderabad. I'm here to give you a brief description about hypertension and its importance in the current practices of medicine. I'm sure you're all aware that there's a lot of metabolic diseases that are happening throughout the clinical scenarios. So gone those days where we used to see more of infective diseases, rather we see more of metabolic diseases. When I say metabolic diseases, those few things I'd like to mention here is one of them is hypertension, diabetes, high cholesterol, dyslipidemia, dyselectrolytemia, vitamin deficiencies, arthritis, osteoporosis, stress. So it goes on, the list goes on. It's more to do with non-infective causes. I'm sure you're all aware of as well that diabetes plays a major chunk of the clinical practice for any practitioner of my kind. Equally, on parallel grounds, hypertension is also very evident. If you look at the statistics, we have the highest amount of cardiac disease and mortality as compared to the Western population, particularly relating to coronary artery disease, which could be correlated to hypertension again. So I'd like to emphasize more on public awareness about this and try to understand why hypertension is important in terms of prevention of complications and comorbidities. So I'm also wanting to know that, when there is a person affected with one kind of a metabolic disease, for example, diabetes, there is a doubling component of hypertension in such patients over a period of time. So it is essential that you should probably diagnose it early, correct it early, and sustain the correction for a longer duration of time in order to prevent complications, comorbidities, and hospitalization. So I'd like to start off saying that what is normal hypertension? A normal hypertension, a normal blood pressure is something which is around less than 120 and 80. And if you were to check your blood pressure, there are certain principles I'd like you to emphasize upon. One, you shouldn't have exercised 30 minutes prior. You shouldn't have taken any caffeine or tea or exercise 30 minutes prior to this. You should have relaxed very well. You should not be talking on your mobile or talking to somebody. You should rest, relax, and then go for the assessment of blood pressure. That is how it should be done in a quiet surrounding area. For the first time, somebody needs to have an assessment on hypertension. I would not conclude that an abnormal first reading is branding that person as hypertensive. You probably require about 3 to 4 consecutive readings in a particular week or a few days gap. Sustaining saying that it's an abnormal recording. That abnormal recording should be around 140 and 90 above. If such recordings are consistently elevated on 3 to 4 occasions, you call these people as hypertensives. Now, unfortunately, if you look at the statistical data, the number of people who are not aware that they're hypertensive are much more than the people who are aware that they're hypertensive. And of them who are aware of that they're hypertensive, only 50% attend to the medical attention. And of the 50% who attend to the medical attention, only a few would actually go and take their complete medication prescribed by the particular physician. And of them, they sustain it longer to achieve the targets as well. So very, very few numbers are actually reaching the targets to avoid complications related to hypertension. Particularly when you talk about complications to hypertension, you should talk about retinopathy, brain effect in the form of stroke and vascular dementia, cardiac disease in the form of coronary artery disease, and also quite frequently we come across renal disease and cardiorenal syndromes. So these are the commonest manifestations that a hypertensive will go on to develop if it is not being attended and treated for. Now, if you look at the population, who are the people who are at risk of hypertension? Number one, getting older is a risk factor for hypertension. Dyslipidemia is a risk factor for hypertension. Tobacco usage is a risk factor for hypertension. Excessive consumption of alcohol is a risk for hypertension. So all this risk population should actually be screened. And if you look at the statistical data of late, there are a lot of people developing hypertension at a younger age. When I say younger age, around the second decade of life, particularly people who are working in odd hours, who are not getting adequate sleep, and who are stressed with the targets or the work job or the work profile they do. And also to this, diet plays a crucial role when somebody is developing hypertension. I'm sure you're all aware that hypertension has got some specific diet program which is called DASH diet. So on this note, I'd like to say you avoid processed food, fatty food, salty food. These are very, very important in terms of controlling blood pressure. So again, if somebody is sedentary, somebody is obese, and somebody is not maintaining proper weight, they also tend to have hypertension in the due course of time. So when you talk about weight, weight plays a very critical role pertaining to metabolic disease. In weight, you would probably want to concentrate on body mass index. When I say body mass index, the body mass index should be calibrated below 25. An ideal scenario, an Indian subset of population, I'd want the body mass index to be around 22 to 23 to avoid such medical diseases, particularly related to metabolic diseases. Now, when somebody has developed hypertension, it's again important and essential to rule out secondary causes of hypertension. The secondary causes of hypertension could relate to the structural abnormalities in the body, particularly the brain, the heart, and the kidneys. Those screenings should be addressed to as well. Now, another area of concern, what hypertensive people definitely I come across in my clinical practice ignore is that they don't exercise, they don't diet properly. So when you say exercise, exercise should have all the components of exercise. There should be yoga, there should be meditation, there should be anaerobic exercise, and there should be muscle mass building exercises. Most of it will be achieved by doing a 30-minute walk on a daily basis to achieve this target. And especially pertaining to the weight, you should also monitor the diet you eat. When you say diet you eat, hypertension persons are favored by eating more of fresh fruits and vegetables because they have a lot of potassium in that. That way you can reduce the salt intake. Salt is another component that our subset of people consume quite a lot. I would definitely limit the amount of salt that you're taking. I kind of feel in my own clinical practice that you should not add any excess salt to the food you're already consuming. Most rich potassium substitutes in the form of natural things are, bananas and some fruits like that would help in actually controlling hypertension. If you look at the references of statistical data, there is a significant drop up to about 10 to 12 mm of systolic blood pressure if somebody was able to maintain a DASH diet, which is less in cholesterol, high in fiber, and fresh in fruits and potassium. This would help in regulating blood pressure naturally. Apart from exercise, apart from proper sleep, apart from maintaining proper diet, these are the methods of looking how hypertension can be naturally monitored and measured. Now, comes to the scenario, doing all this doesn't really help the situation, then perhaps you need to consult a doctor, undergo thorough investigations of the causes for hypertension. Once determined, they should be able to be put on some form of medication as per the doctor recommendation and the patient comorbidities. And those medicines are normally related to either ACE inhibitor or ARBs or a diuretic or a calcium channel blocker or a beta blocker, depending on the choice from the physician whom the patient is referring to. So there are empty number of choices of drugs available in terms of controlling blood pressure, apart from natural measures. And all this put together, you can actually avoid hypertensive crisis, hypertensive complications, hypertensive comorbidities, resulting in long and healthy life. Thank you.